Treatment of sixth nerve palsy differs whether the palsy is acute or chronic. A waiting period is advisable in all patients with acquired sixth nerve palsy. During this interval, the patient should be repeatedly examined, the deviation measured, and the field of a single binocular vision is determined. We wait at least 6 months before operating. We patch one eye to eliminate diplopia. Leave the choice of eye to be patched to the patient. Sector occlusion with translucent adhesive tap is helpful in relieving diplopia in the paretic field of gaze. The segment of the lens to be occluded is individually determined. According to the patient's preference, we occlude the temporal segment of the lens before the paretic eye and the nasal segment before the sound eye. In bilateral paresis, bitemporal or binasal occlusion may be effective in relieving diplopia. Botox injection of the medial rectus muscle has been advocated by several authors. In chronic cases, usually surgery is planned. Before surgery is planned, it's mandatory to determine to what extent limited abduction is caused by the paralysis or by secondary contraction of the medial rectus muscle. The forced adduction test usually provides the answer. When this test is positive, an estimation of the generated muscle force by the lateral rectus as the adducted eye moves toward primary position informs the surgeon whether release of a restricted medial rectus muscle alone will improve the abduction. In the presence of a complete paralysis, surgical expectations must be guarded. We combine a muscle transposition of the vertical recti or a union of these muscles with the lateral rectus as described by Janssen, which is called Janssen procedure. This is combined with recession of the medial rectus muscle. Botox injection in the medial rectus muscle instead of recession may be used with the advantage of decreasing the risk of anterior segment ischemia. When residual lateral rectus function can be demonstrated, a maximal recession of the medial rectus and the resection of the lateral rectus muscle are effecting in enlarging the field of single binocular vision with alignment in the primary position.